Welcome to Science and Life.
Why worry about SARS-CoV-2? If seasonal flu kills more people, why do we have to worry about SARS-CoV-2, the virus that causes the disease called COVID-19? With the spread of SARS-CoV-2 across the globe, people are panicking, which is reasonable to some extent. So far, as of today, March 5, 2020, there are 96,950 reported cases with 3,308 deaths. How do these numbers compare with those attained during the flu season in 2018? According to the CDC, there were 48.8 million infections leading to 79,400 deaths in the United States alone. Based on current statistics across the world, the fatality rate from SARS-CoV-2 infection is 3.4%. The fatality rate during the flu season in 2018 was 0.16%. So, the seasonal flu is milder than the current version of the coronavirus. If SARS-CoV-2 infects the same number of people as the flu virus did in 2018, there will be 1.66 million deaths in the United States alone. In fact, using mathematical modeling, the infectious disease experts and epidemiologists are projecting SARS-CoV-2 would expect to infect 40 to 70% of the world's adult population, killing millions of people. Coronavirus is a flu virus too. Out of 7 coronaviruses so far known to infect humans, 4 of them cause common cold with rare incidences of death. The other 3, MERS-CoV, SARS-CoV, and now SARS-CoV-2, cause fatality in humans at different degrees. The fatality rate of the SARS-CoV outbreak in 2003 was 10%, and 35% of fatality rate was associated with MERS-CoV infection. As reported in the Journal of American Medical Association, the average fatality rate of the new SARS-CoV-2 is estimated to be 2.3%, which is based on 44,672 positive and symptomatic cases reported in China, presumably due to the smaller number of sample size, which is 44,672. The fatality rate is smaller, 2.3%, than that estimated from a large sample size as described above, which is 3.4%. There were 1% asymptomatic individuals who were tested positive for the presence of the virus but did not show symptoms. They are equally contagious as patients showing symptoms and present a great risk of spreading the virus. Symptomatic infections go up with age. Symptomatic infections also present the risk of fatality. Scientists have studied the distribution of the infections and fatalities across the age groups in coronavirus infection in China. In the reported Chinese cohort, the highest infection rate was found in the middle age groups from 30 to 70 years. The fatality rate increases with the age. Significantly low fatality rate was observed in age groups up to 50 years. An 8% fatality rate was noted among the patients between 70 to 79. This number jumped to 14.8% among those of 80 years and older. SARS-CoV-2 infection can vary, causing mild, severe, and critical conditions. Mild infections were 81% of the infected cases, severe infections were 14%, and 5% were critical. The infections were resolved in mild and severe cases generally with no fatalities. However, there was a 49% fatality rate among critical cases. What do we know so far about coronavirus infection during pregnancy? In a small study of 9 pregnant cases in China, positive for the virus, showed no vertical transmission to the fetus. That means they all had a cesarean section in the 3rd trimester to deliver uninfected children. However, newborn babies born to already infected pregnant mothers can easily get infected for being in close contact with the mother. While scientists are grappling to understand various aspects of this novel virus causing the havoc on the human population, the virus is spreading throughout the globe. By many accounts, SARS-CoV-2 is already a pandemic, yet the World Health Organization is refraining from officially labeling SARS-CoV-2 infection as a pandemic. This is probably due to the potential negative impacts on the world's economy, which are already happening throughout the world.
Hope you learned something new.